Local medical facilities, an addiction center and county agencies are preparing for an influx of patients and addicted individuals who may have been allegedly overprescribed by Dr. Raymond Kranick, a Mount Carmel physician accused by federal authorities of being the largest pill mill operator in the state. Officials at Geisinger in Danville, UPMC Susquehanna-Sunbury, the non-profit addiction help center outside Mount Carmel, the Northumberland County Area Agency on Aging and the county coroner's office said they are expecting unintended consequences associated with Kranick's arrest. Kranick allegedly prescribed more than 6 million opioids like OxyContin, Vicodin and fentanyl between May 2012 through July 2017 and is responsible in the overdose deaths of 5 patients from October 2013 through May 2015 according to court documents. No doctor in all of Pennsylvania prescribed more doses of opioids in the 19 months leading into July 2017 than Kranick's 2,792,490, according to Assistant U.S. Attorney William B.A. Marissa Burke, spokeswoman for Geisinger, and Dr. Margaret Jarvis, the chief of addiction medicine for Geisinger, said discussions have been had in the health networking about patients who may be seeking another physician and about the people with addictions who could overdose if they turn to harder drugs such as heroin or prescription drugs off the street. It's been a story all over the country, Jarvis said. These things happen, and the supply of pharmaceuticals have been squeezed, then more and more people turn to heroin and/or fentanyl. It drives a fair bit of the overdoses. I wish that were not the case. The bigger question is what can be done for people after they have been treated for overdose, the treatment and services of which are underserved, Jarvis said. I hope the silver lining of this is that we start do something different, Jarvis said. Jarvis expects to see people going through withdrawal, and there's no immediate answer for them, she said. The emergency rooms at Geisinger facilities are prepared for the events and are stocked with Narcan, an opiate antidote that reverses the overdose effects of certain drugs like heroin or prescription pain medication, Jarvis and Burke said. The emergency medical teams are always prepared should there be an influx of patients coming in, Burke said. We have operational systems in place should there be an overflow. An extra counsel Laura Cotino, the founder of the Addiction Help Center along Route 61 in Atlas, just outside the borough line of Mount Carmel, said the organization decided on Friday to bring in an extra counselor with hopes to pay for it through a series of local grants. The aftercare facility provides counseling for individuals who have been through rehabilitation services for alcohol and substance abuse. Addicts will search for their drugs on the street, and the price will go up, Cotino said. After they run out of money, heroin will be the cheapest thing you can do, he said. Another thing that bothers me, a lot of heroin dealers with this kind of publicity will flood this area. They'll see this target. Cotino said he was aware that Kranick was overprescribing because a lot of his patients came into the help center. Cotino had conversations with the doctor, but the real battle has to be with the people using, he said. I'm happy it's going to shake everybody up, all these doctors, that is good, Cotino said. I'm not looking forward to the backlash. After that, we have a good head start and start cleaning up the area. We're going to have to go through some rougher times before they get better. Coroner prepared Northumberland County Coroner James Kelly said he, too, is concerned about the patients, but nothing specific can be done to prepare. If a call comes in, we respond, Kelly said. I'm always prepared for it. We're always prepared for it. We've seen an increase in it. Calls to Kelly to identify the 5 overdose victims identified by their initials in the federal indictment were not returned Friday. The Daily Item has filed a right-to-know request to the coroner's office for the identities and a freedom of information request to the Drug Enforcement Agency. Tyler Wagner, the communications specialist for UPMC Susquehanna, said the situation is being monitored locally, including UPMC's facility in Sunbury. We are still new to this region and UPMC Susquehanna is still becoming familiar with the resources that may be available, Wagner said. UPMC Susquehanna-Sunbury's emergency department is prepared to see and care for patients as we would any other day. It's unfortunate for patients who must figure out their insurance coverage and new doctors, Jarvis said. None of that is easy, none of that is fast, she said. There's nothing about this that is good. You wish the world was perfect. Older citizen Karen Leonovich, the administrator for the Area Agency on Aging, said she is concerned about the patient care of the older citizens who need legitimate health care that were patients of Kranick. Her agency is prepared to assist those people. We know who the doctors are of most of the people we serve, she said. We have that information available. We haven't heard anything yet, but we will be reaching out to them if they need assistance for finding another doctor or making arrangements for appointments, anything we can do to maintain their healthcare needs. The county coordinates with Rapid Transit's shared ride program for those who need transportation to their doctor's appointments, and the agency pays the rate for them to attend, Leonovich said. It's never easy if you've gone to someone for years, Leonovich said. It's a hard transition to go to a new physician. There are not a lot of physicians in the immediate area, and it will be difficult to find someone who will take them quickly. We will help out with the transitions and the paperwork. Many of these older adults have issues that are more intense and need more medical attention, she said. A lot of the seniors we assist are frail, vulnerable, in their homes and alone, Leonovich said. They will need assistance in getting help and the transition completed. April Hutchison, Communications Director for the State Department of Health, offered some advice for patients. In the face of the opioid epidemic, it is unconscionable that a physician would abuse his patients in this way, she said. Patients who use Dr. Kranick as their physician can contact their health insurance provider to find another physician in their area. For those who are uninsured or underinsured, there are resources available through local federally qualified health clinics, and immunization services from the State Health Center. Email Justin Strasser at jstrasser@dailyitem.com. Follow him on Twitter at JustinLStrasser.